So staying with the story, co-lead investigator at the Sisonke program, Professor Linda Gale Becker, joins us now live. Linda, thanks for your time. We appreciate it. Of course, you've been very busy, but let's get some clarity on this. Our reporters are finding that some elderly people have been in those vaccination queues getting vaccinated yesterday, some even today. Is that supposed to be happening or not?
So the Sisonke Phase 3B study has in its protocol that we are targeting healthcare workers. There is an expanded definition of that, which includes not only people who are daily facing patients in a clinical aspect, but also those who are in the support staff category. So those are the only individuals that should be included in the Sisonke Phase 3B protocol.
Yeah, so I've seen just under 500,000 healthcare workers have been vaccinated according to what government said overnight. Are you satisfied with just how long or fast it took you to get this done?
You know, to do this, we've relied, and that's in the spirit of the research study, we've needed to have every vaccine center linked to a research site. So there are about 40 of these that are available to conduct Sisonke, and so given that constraint, given that we've had to move to different vaccine centers, reposition ourselves both in quite rural areas as well as metro areas, I think it's been extraordinary. And yes, quite right, Heidi mentioned we were up to almost 19,000 individuals vaccinated yesterday. This is, I think, an extraordinary effort, given, these individuals are working with their vaccine center colleagues from early in the morning until late in the afternoon, literally pushing out these vaccines as quickly as possible. We haven't quite reached the 500,000 mark. That's what we're heading for. And this is where, we're very pleased to see that there are queues. We're hoping to finish all the Sisonke doses by Saturday.
So you have 414,000 healthcare workers vaccinated. This is supposed to end by Friday. You reckon you're going to reach that 500,000?
We may have to spill on to Saturday, yes, hence the need to reach the target of 20,000 a day. So we are speaking to every single vaccine team, literally counting doses every evening, reassigning them in the morning. It's become a bit of a military operation to make sure we do reach that 50,000 mark certainly by the weekend. And the reason for that is we do want to try and disassociate from 1B and 2, so that when the national rollout starts properly with 1B, Sisonke is kind of done and dusted. That's been the plan.
Linda, I'm trying to get some context on how possible it's going to be to vaccinate 41 million people in South Africa and how long it's going to take. So with the 500 doses that have been done so far, well, up until Saturday probably, how many days has it taken us to inoculate these people?
It's taken us, since the 17th of February because of a number of factors. The one is we've had to wait for research dose allocations to be brought into the country. So as we've had a tranche, we've used them up, but they haven't, they haven't come as one large batch where we could decide the pace at which we were going to work. Secondly, I've already mentioned these had to be linked to research teams, and there were 41 teams across the whole country. In fact, we had to move a team into the Northern Cape because we don't have a research team in the Northern Cape. So we actually had to, sort of transport them into the Northern Cape. I think the national rollout is on a different scale. Now, I'm not in charge of the national rollout, but from what I understand is this is going to be on a very different scale. We are going to see each province have a large number of vaccine centers that will work concurrently. And so, I think we will move out of, if you like, almost a pilot phase that has been the Sisonke 3B, and we'll move into the national program. And my understanding is that national government and their provincial teams expect to vaccinate far more people daily than what we have been able to achieve with the constraints that we've had.
Lastly, and very quickly, because I've run out of time, let's talk about any other side effects that you have seen in the Sisonke trial, apart from the blood clotting that was raised abroad.
So we have not seen anything that would alert us to any specific set of trends. As mentioned, many people have experienced reactogenicity. That is expected, that is normal. We ourselves have not had a case of this unusual vaccine-related thrombocytopenic thrombosis for its full term, which is heartening. But obviously, we're very much on the lookout, and we've really strengthened our safety efforts, and we're watching out for that should it happen.
All right, thank you so much for your time and your insight. Appreciate it. Well done on the work. That, of course, is Linda Gale Becker, co-lead on the Sisonke trial.